Medical Mysteries ZeiViral. What you are about to hear challenges everything you know about medicine. Few people realize that some cases are so complex they leave even the best specialists without answers. Imagine experiencing pain, fatigue, and mysterious fevers. No doctor can uncover the cause. This is the enigma of a patient whose medical history seemed like an impossible puzzle. And what happened next will completely change the way you see medical science. What you're about to hear will challenge everything you think you know about medicine. This is a real medical mystery. One patient's body sent signal after signal, and for months no doctor could connect the dots. Chronic pain, relentless fatigue, unexplained fevers, and rapid weight loss, yet every test only deepened the puzzle. Stay with me. The diagnosis that finally emerged shocked clinicians and changed the way we look at rare diseases and impossible diagnoses. He was 35, active, with a clean medical history until the symptoms began. At first it was crushing fatigue and diffuse muscle pain that wouldn't quit. Then came high fevers that flared without pattern and weight that slipped away for no reason. Family history added red flags. Relatives with autoimmune conditions like lupus and rheumatoid arthritis add a background of anxiety and little psychosocial support, and the whole picture grew more tangled. With each clinic visit, new complaints stacked up, but clear answers stayed stubbornly out of reach. The symptoms behaved like a living puzzle. Fatigue worsened in waves, muscle pain migrated and intensified, and strange skin reactions appeared in places that made no sense. Fever spikes would interrupt stretches of apparent normality. Lab after lab, scan after scan, produced fragments elevated inflammatory markers here, a non-specific skin biopsy there, but nothing that fit a known diagnosis. Each symptom seemed to tell its own story. Together they formed a pattern no textbook recognized. Every specialist who reviewed the case left with more questions than answers. Investigations moved from routine to exhaustive. Clinicians performed detailed histories and repeated physical exams, trying to catch clues the first time missed. Hematology panels, inflammatory markers, autoimmune screens, advanced imaging, and even genetic testing were ordered. Mr. Im's returned mostly normal or inconclusive results, frustrating the team. The case demanded a multidisciplinary approach. Neurology, hematology, rheumatology, infectious disease, and oncology all weighed in. Still, despite exhaustive testing, the diagnosis remained elusive. It felt as if medicine was chasing a shadow. When standard routes failed, theories multiplied. Some experts argued for a rare autoimmune disorder that mimicked multiple diseases simultaneously. Others suspected prolonged exposure to an environmental toxin, something insidious, invisible, and slow-acting. A third camp warned that psychological stress and chronic anxiety could be amplifying physical symptoms, blurring the line between mind and body. Each hypothesis was plausible, each partially supported by data, and yet none fully explained the mosaic of signs. The debate grew intense. The team needed a pivot to break the stalemate. The pivot came from a test that initially seemed routine but was performed with extraordinary scrutiny. A high-resolution MRI focused on subtle brain structures. The images revealed anomalies so faint they had been overlooked before, teeny changes in regions tied to autonomic regulation and sensory motor processing. Those subtle markers shifted the diagnostic lens. Coupled with targeted blood tests that identified specific biomarkers, the pattern pointed toward a rare neurodegenerative condition, one not commonly associated with this exact clinical presentation. The name stunned everyone. For once, the mystery had a medical label. Confirmation brought complicated relief. The diagnosis answered why the symptoms were so mixed and why standard tests failed. The disease affected systems in a patchwork way, producing multi-system dysfunction that masqueraded as other disorders. With a name and pathophysiology to work from, the medical team designed a tailored treatment plan. It was not a cure, but it offered purpose, symptom control, slowing progression where possible, and restoring quality of life. Treatment became multidisciplinary: neurologic management, symptom-targeted medications, physiotherapy, occupational therapy, and carefully monitored supportive care. Recovery wasn't a single event. It was a slow rebuilding. Medication regimens aimed to stabilize the most dangerous manifestations, while rehab focused on regaining daily function. Lifestyle shifts were crucial. Anti-inflammatory nutrition, controlled exercise, sleep hygiene, and strict avoidance of suspected environmental triggers. Psychological support provided coping tools and reduced symptom amplification. Support groups introduced the patient to others facing rare conditions, offering shared strategies and emotional refuge. The goal was no longer just to fix the body, but to rebuild a life around it. This case left lessons far beyond a single diagnosis. First, it highlights the power and limits of modern diagnostics. Advanced imaging and biomarker testing can reveal hidden diseases, but only if clinicians keep searching and revisit assumptions. Second, it underscored the necessity of empathy. Patients with unexplained symptoms suffer twice physically and emotionally, and the way clinicians listen matters. Finally, it proved the value of teamwork. Complex cases demand collaboration across specialties and open-minded thinking. If this story taught us anything, it's that medicine still has mysteries and that solving them requires patience, science, and human compassion. Would you have guessed the diagnosis from the symptoms we described? Share your thoughts in the comments below. If you want more deep dives into rare diseases, impossible diagnoses, and real medical mysteries, subscribe to Medical Mysteries ZeiViral and hit the bell. Visit ZeiViral.com for transcripts, sources, and further reading. Thanks for watching and stay curious.